Now, Dr. Harris, we're obviously hearing so much voluminous responses right now from people who are just frustrated. They say they're eligible to get a shot, but they're not able to book an appointment.
Sure. I mean, this is a series of challenges that we have to overcome as a health system, as a region, a state, and as a country. But we have persevered through a year of coronavirus, of trialing times, of deaths, of family members being sick. And this is the first step, in addition to masks and social distancing, that we have an opportunity to really make a dent in the pandemic. And while there are certainly a number of challenges we have to overcome, I'm confident in our region, our state, and our health system and our partner institutions that we're going to be able to do this.
You know, I think a few months ago, we might have thought that the problem was going to be to convince people to get the shot. You know, we wanted to make sure they knew it was safe, that they didn't question the efficacy or the data or, you know, maybe even the branding of Operation Warp Speed. But boy, we've got the people, they're ready. But now it doesn't seem as though we have enough places that are ready to give out these shots.
Well, I'm excited at the fact that people want this vaccine. I think you hit the nail on the head that we've come a long way in showing people that the science works, that we have produced a safe and effective vaccine, and now it's time to get shots into arms. Right now, we face a supply issue. The federal government allocates 300,000 shots, 3,000 doses rather, to the state of New York, which then in turn distributes that in an equitable fashion throughout the 10 economic regions of New York. I can assure you that as soon as vaccine doses become available to us here at Northwell and our colleagues in the community, appointments go immediately available online. And you're correct that right now we are lacking supply. We are looking forward to the upcoming weeks, and we do anticipate with the new administration that there will be a considerable increase in the supply of vaccine doses available. And when those doses do come available, there will be appointments to get them.
And you know, we're hearing these stories, hundreds of people desperately flocking to the Brooklyn Army Terminal and only to be turned away because they thought that they were going to be throwing away possible doses. You had people sharing a website, and people made appointments and then canceled the other appointments they had. That was at Stony Brook University, only to have those canceled. So I think, you know, really there's this mounting frustration, but where's kind of the relief? Where's the light at the end of the tunnel? Where's the next step in this?
Sure. I sense that frustration in my family members in our community. And I want to reassure everyone that not just Northwell, but our colleagues in the community are making every effort to make this process easier, to make this process smoother, from signing up for vaccines online to finding locations that are proximate to your house and close to where you live and your friends and family. As I've mentioned, we are eagerly awaiting for more supply to come in. One of the things I would encourage everyone to do is to continue to be advocates for your family, continue to be advocates for yourself. Check those websites. You can find information about vaccine availability as it continues to roll out through the New York State Department of Health website, your local county health websites, and then institutions like Northwell and other hospitals in the region all have hotlines, call centers, and websites with a great deal of information, multiple languages, to help roll out this process in a more smooth manner.